Thank you very much. Speaking about medicine shortages in Germany, I'm referring on the ABDA report of December 2020. ABDA is a National Association of Community and Hospital Pharmacists, and the definition of shortage is longer than 2 weeks supply interruption or unavailability to cover increased demand. So now if you look on the development of the percentages of pharmacies to consider medicine shortages as a major problem in their daily work, you see that in 2016 was under 50%, increased very much. And you see a little improvement in 2020, but still remains that 83% of the pharmacists consider this as a major problem. And in addition, 62% of the pharmacists need more than 10% of their work time to solve the problems, which is a lot because it means 10% less for the patients. Now, a major problem for my colleagues in the community is in Germany that Germany healthcare system is based on social insurances, and we have more than 100, and every patient can choose one of the 100. Now, every insurers make discount contracts with companies to have a generic at lower price. And only this one generic medicine will be reimbursed by the health insurance. In case of shortage, it's very difficult to get reimbursed. It's a very bureaucratic, complicated procedure. If you now look on the number of boxes in shortage in 2017 and in 2019, we don't have the data for 2020. Well, you see that's a big problem. And you can imagine this is also a very big problem in terms of medication safety. The only good news due to the COVID situation, the situation worsened, but insurance are well now understanding that they have to be more flexible. Now looking on the drug classes involved, there are really differences between community pharmacies and hospital pharmacies. In common is the problem of antibiotics. And I think that's very cumbersome because antibiotics are very important, and especially if you think about resistance and so on. That's a major problem, mentioned also from other colleagues from other countries. In the community, cardiovascular system makes 40%, close to 40%. A major problem are oncology drugs in the hospital and blood products. Neurology is in the community a problem. And the granularity of hospital is bigger. You see the other, including a lot of drugs, make 30% of the shortages. In Germany, we also have an official list by our national competent authority. I looked on today ago on the shortages, and on the list are at the moment 2011 drugs and 6 vaccines, where vaccines doesn't include COVID vaccines because that's a centralized. And to be honest, we have really a disaster in Germany concerning the vaccines against COVID. So, and that's all for a short overview of the situation in Germany. Thank you very much for your attention.